everyone. Happy evening, a very good evening. I hope and I believe all of you are doing well. A quick nod whether I'm audible and visible, everyone. Okay, that's great. So, if we have FMG students here who are here to check, how well you have done with radiology, I hope you have done the entire paper very well because overall the questions seem to be on the easier side. Definitely the paper was not very difficult. It was very doable. Of course, there are going to be some questions which will be like out of the box, but getting that 150 out of 300 was very much doable. So I hope the exam has treated each one of you very well. So time to, I think, take a break, relax, rejuvenate, refresh, and yes. So what we are going to do here is discuss the radiology questions. Now remember that these questions are all recall based, and I would like you guys to comment on whether there is any change, edits in the question or the options that you feel was there. And for the NEET PG students, these questions should tell you that what kind of questions are being asked in the exam. Like there's one question which is out of the box, like the PSMA scan, the PET scan. I have discussed it in the radiology main videos, right, and in the rapid revision nuclear medicine videos as well. But those questions are always going to be there. So let's quickly have a look at the questions. Raj, don't worry, you will be able to do that. Okay, just stay positive and let's just take a break till the results. Okay, no worries, nothing till the results are out, right? So starting with the discussion of the radiology questions, this is one question that was asked. Now till now, the most commonly asked question was the double bubble, that was duodenal atresia. But this time the question asked was the triple bubble, probably because the examiners knew that कि सब लोग अभी double bubble करके आते हैं, so they thought let's this time ask the triple bubble, right? So what do we see here is this is the triple bubble and this is jejunal atresia, right? I hope all of you know the concept. When stomach is obstructed, single bubble, next duodenum double bubble, next jejunum triple bubble, and next ileal it is going to be multiple bubble. So depending on where is the narrowing, where is the atresia, the number of bubbles is what you see in the X-ray, right? So here there are 3 bubbles that we are seeing here. So this is jejunal atresia, right? Triple bubble is jejunal atresia. Going to the next question, this is what we were saying, a bit out of the box question. The PSMA scan is used to diagnose which of the following, right? In FMG, there's no negative marking. So, of course, there has to be no question which you are not marking the answer for. So, when you have to take a guess, remember prostate cancer, PSA, PSMA, going very, sounding very similar, rhyming. So, obviously, you can take the guess here that it's going to be prostate cancer. So, PSMA is prostate specific membrane antigen. Okay, this is prostate specific membrane antigen that is detected by the PET scan, the PSMA PET, for detecting those prostate cancer cells which have this prostate specific membrane antigen. Okay, so this is for prostate cancer. Yes, Shivam, correct. Well, what is the diagnosis based on the given X-ray? This is again a favorite for the FMG exam, right? What is this one that you are seeing is miliary TB, where you have multiple millet seeds like dots throughout both the lungs. This is miliary TB. Previously, there has also been question on cannonball metastasis in the exam, where in both the lungs you would have big wall-like things. They're much bigger. This is miliary TB. Remember, ARDS will have like alveolar pathology, consolidation जैसे image आएगा bilateral, ऐसे छोटे-छोटे नहीं आएंगे. This is miliary TB, right? Almost all the questions that are there we have discussed in our classes, right? So I think radiology was also easy, it was not difficult. What is the diagnosis based on the given X-ray? Again a favorite, either pneumoperitoneum, either pneumothorax in the exam is a favorite topic, right? They expect you to know that. So this is air under diaphragm, this is black air under diaphragm, this is pneumoperitoneum. I think the option might have given the hollow viscous perforation, right? The hollow viscous perforation, this is pneumoperitoneum. Okay, this is pneumoperitoneum. Now remember, esophageal perforation will lead to what? Esophagus in the thorax, when perforating, it will lead to pneumomediastinum. Okay, that will lead to pneumomediastinum, air in the mediastinal cavity. This is pneumoperitoneum hollow viscous perforation. This is a similar question that has been asked in the recent FMG, like the past FMG, where they give you the question of a patient with peptic ulcer, gastric ulcer, having abdominal pain, and now presents with sudden acute increase in pain, guarding rigidity. So many times in the question of pneumoperitoneum, remember that you are given this background history of peptic ulcer also. Okay, peptic ulcer as well. And remember, whenever there is perforation, you will not use barium. Barium is contraindicated. Okay, I'm telling you the extra points for the NEET PG students also here for your upcoming exam. So you should remember all of this, that barium is contraindicated in perforation. You will use iodinated contrast because it is water soluble. So we will use water soluble iodinated contrast, most common and safest being iohexol. Okay, that is iohexol. Right? Is this clear? Right. Next one. What is the diagnosis based on the given X-ray? I think was there a history in this question, like there is a patient who has history of TB and now the X-ray was given. Past history of TB, was that given in the question? Yes or no? Right. So based on the history also, you can make a guess here that this is aspergilloma. Why? Because TB. Aspergilloma fungal ball comes in a pre-existing cavity in the lung. Like TB has a cavity, usme the fungal ball come, that is aspergilloma. So what happens in that case, if this is the cavity, inside that what comes is the fungal ball. So the remaining air, the air which is remaining, what sign does it give, the remaining air that you have? The remaining air appears like a crescent. Okay. So this is called as air crescent sign or monod sign. Okay, air crescent sign or monod sign. So remember, this is aspergilloma. Okay, this is aspergilloma. Bronchogenic cyst bhi tha option mein. Bronchogenic cyst. If it was just bronchogenic cyst, remember the image will give you this water containing cystic lesion. So it will be all white. It will not have this one here where inside the cavity you are seeing some wall and then you are seeing the air. Okay? Is this clear? Right. See, if it is a patient of lung abscess has air fluid level which is a horizontal level, not like this a rounded fungal ball and then this air crescent sign. The lung abscess has a horizontal level, not a crescent like this, and lung abscess ka patient will have more high grade fever, aspiration hua hai, right? The history will be different in that case. Okay, that's great, Ashutosh. Right, so I hope all of you will be able to differentiate this. If it's a hydatid cyst, which is again another favorite, there's a history of farmer, contact with cattle, dog, sheep, that all is going to be there in the background history. So remember that in the recent years, the radiology questions that we are seeing, the clinical history, background history is very, very important, the clue there. Thank you so much, Shivam. Next one, this is favorite for all the examiners, I believe, whether it's NEET PG, it's INI-CET, it's FMG, everywhere you would see this, parathyroid, hyperparathyroidism, what will you do, what nuclear scan will you do? So a 40-year-old female presents with complaints of abdominal pain, there is elevated PTH, renal calculi already given. So what investigation will you do next? Technetium 99 system EB scan, right? Remember we do system EB scan. Sometimes in the question, they can just give you the MEB scan also as the option. And in hyperparathyroidism, this history of renal calculi because there's hypercalcemia is given. Remember, there are stones, bones, groans and moans. Okay, stones, bones, groans and moans. That is renal stones, bone pain, abdominal pain, moaning, that is psychiatric features. All this is hyperparathyroidism. And INI-CET last year exam question was, which of the following is the best? There were two options for system EB. One was technetium system EB scan and one was the system EB SPECT. So remember that in nuclear medicine, SPECT has a better resolution than the technetium 99 scintigraphy. Imagine like SPECT is like a CT, scintigraphy is like a X-ray. Obviously, CT has a better resolution than the X-ray. So in that case, the answer is going to be SPECT if you have both scintigraphy and the SPECT in the options. Say it. Okay, technetium 99 parathyroid. Okay, so that is the answer here. Going to next one, which among the following is the most radiosensitive? Now remember that they've not mentioned here whether this is bone marrow particularly, or so it's a bone surface or it's a bone marrow. So we will just take it as bone. So overall, if you compare, we have seen in our the sessions, the videos as well, that overall the most radiosensitive tissue is bone marrow. But if you come about the overall organ, gonads are the most sensitive. So the answer here is going to be testis. Okay, the answer here is going to be testis. Okay, right. There is this law of Bergoni. The cells which are actively dividing are sensitive. The cells which are not dividing are resistant. Like nerve is going to be resistant. Okay, so this is the organ is going to be testis. The tissue is going to be bone marrow. Okay, bone marrow. Right. Going to next one, guys, was there any question related to PET-CT? First, an image was given to identify the investigation. Was it there? Second, what radioisotope is used, if that was the question, FTG is used. And third, what principle, probably there was some principle of glucose metabolism wala principle use hota hai. What question was asked here? What question was asked here on PET-CT? Was it the investigation identification asked, or was it the radioisotope asked, or was it the glucose metabolism that was asked? Warburg phenomenon पूछा था? क्या पूछा था? Warburg phenomenon. FDG was asked. Okay, so whatever I've given you all the three options, so you know what is going to be the answer for that. Then there was this one question on the pages. X-ray skull was given with the cotton wool spots. Okay, X-ray skull with the cotton wool spots, and they are giving you that alkaline phosphatase is high, rest everything is normal. We have discussed so many times this. So remember that this is going to be pages. Okay, this is going to be pages where alkaline phosphatase is high and rest everything is normal, versus we have already seen that, which is the condition where alkaline phosphatase is normal, but you have alkaline phosphatase is normal, but the calcium is high. What condition will that be in that case? In that case, it will be multiple myeloma. Remember, in multiple myeloma, no new bone formation, and that is why the alkaline phosphatase is normal. Okay? Okay, so glucose metabolism was asked here. So those were the questions, and that was a very, very quick recall of the radiology questions. And I believe that if you ask me to score on this, like how easy the questions were, it was definitely, like I would say, 9 on 10 मतलब easy questions थे, बहुत difficult नहीं था. So we are definitely expecting that the passing percentage this time should be great, right? So we are looking forward to a lot of you hearing back from you post results, everyone, and all the very best for the results, and hoping to see you again, for the NEET PG preparation there. Prakash, dekhte hain, theek hai? So thank you so much everyone for joining in. That was for a quick recall, and let's stay connected. If there are any queries, any help you need, please do reach out to us. We shall be more than happy to help you. Okay. Thank you so much everyone. Goodbye and good night. Thank you.